Hello and welcome. This is Dr. GERARD CUOMO. I'm here with my patient Michael from FAU, and he is wearing video eyewear right now. So he's seeing everything that you and I are viewing right at this moment in real time. So let me tell you what we're going to do. We have a couple of areas from toothbrush abrasion, or excuse me, toothpaste abrasion. More studies being done now on that. And if we look at it more closely, we can see the wear and tear, the soft wear and tear at the neck of the tooth. So we're going to restore this component right here, the missing enamel, and put that back into this tooth. How do we do that? We're going to do it with a procedure called bonding. And bonding is real simple. It's a chemical and mechanical locking of a filling on a tooth. It's considered cosmetic, and because it is tooth color, and we do place it in other areas of the mouth that are in the smile zone, but we also know it's very durable and functional as well. So first things first, this is what we call our braided cotton cord. It's used to protect the soft tissue. All right. And we're going to place that first. So it's a small piece, and you're wondering, well, how are we going to tuck that in? Well, with the use of the microscope, we can see and use smaller instruments. So right now, this is normally an explorer for checking decay, and we round off the end of that instrument so that we don't injure the soft tissue. Now we're just literally just tucking it in place. Now I'm going to use another instrument, another periodontal probe, to hold one end while we tuck the rest of it in. So this is what Gail would use, Mike, when she checks you your cleaning. So we're going to just see the braided part of this cord actually keeps it in place. It expands like a Chinese, what do they call it? The old Chinese handcuff. It's got that scissor-ness to it. Yes, you got it. Say that again, John. The thumb cuffs, yeah. Is that the one they hang you upside down from, John? That gets you to talk, right? All right. So there it is. Now we'll focus on this one. We're going to restore this one first, and then we'll go to the lowers. And we even see a little lint right there. Look at that, floated right over on top of the prep. So we got to clean that surface off. I'm going to do it with a fine diamond. We call these burrs in dentistry fine diamond burrs. What they do, they basically are fine diamonds impregnated on top of a very thin piece of metal that's very round and centrifugal. So there's the handpiece, and then we just go lightly, just to dust it ever so lightly.
You doing okay?
Mm-hmm. We're just getting rid of the stain. And we're scoring the surface because we want it to stick, the material. So we're not gouging, we're just ever so gently, I noticed even in orthodontics that some orthodontists don't have any power of magnification, and when they go to polish off the cement after taking brackets, removing brackets, they're finding out that they're finding the surface is being abraded. And so we must insist upon at least a little bit of magnification for orthodontists. Otherwise, it's very hard to imagine that you could gouge into that enamel if you're not careful. So I have a few cases like that, and I'm a little, just a little concerned that the industry hasn't looked at magnification as it really should. I'm not saying that an orthodontist should use a microscope. It would be great if they did, but just to get the fine detail work done, because your patients come in with virtually beautiful enamel on the first surface of the teeth. You want them to leave that way as well. So, okay, we're going to go ahead and rinse this now. We'll just kind of blast this with air and water at the same time. Now, this is my air water syringe. Looks like a fire hose, right? And we notice there's still a little bit of stain. I just want to polish that off. So we'll just do a little bit more under the lip right there and there. There we go. And we'll just rinse that off again. A little bit more. And you can see how meticulous we're getting to that level where we want the best bond. And we just literally dancing. So that was as quick as we can do it. And what we're going to do now is back it up. Is we're going to use a solution now. We got to create the environment for the adhesion. So we're going to use a little mild, very extremely mild acid of phosphoric acid at 34%. And so you're going to see immediately from that these little bubbles. And that's dentin. Usually it's dentin, it's carbon dioxide. So we're creating a surface, clean surface area. We know microscopically what every bubble you see there is probably a little tubule along with that. And so now we can rinse that off. Alright, and we'll go ahead with that. So we do about 15 seconds and we rinse for about 15. That just ensures that the surface layer of that dentin is going to pick up the next step, which is the resin, that substance that bonds the filling to the tooth. It's a layer of adhesive. Back in the days we used to dry the tooth right now. Today it's all wet adhesion. Oh yeah, we don't want those little tubules to collapse, so we barely touch them with that. And that's a chelator. Through modern day chelation, both not only in the vitamin world but also in the dental world, we're able to keep those tubules open, keep them from collapsing, and then just start to enhance bond strength. So this is microdentistry at its finest, and you're able to see our painting layers. We'll go about 4 to 5 layers. She's vacuuming off the transporter, which is alcohol. Alright, so that's what gets it there. Keeps the tubules open, allows the resin to go into place. We used to use acetone, and now we're using, I believe this is an alcohol base, Albon 3 from Bisco Corporation. Yep. Now we're going to light cure that, so Mike, you might want to close your eyes. It gets a little intense here. We're going to light cure that, and we just do a quick light cure. And that's an LED light, high intensity. Why? Because we have fiber optic wand on the end of it. Alright, now we're going to add our composite material. It's a putty material. It comes out of a tube. It has a little plunger on the end of it. And I'll use a gold instrument too. Okay, so I want to make sure I'm in the middle. Now we did reduce the light so that we don't prematurely set this material. Let me look at the A3 as well, Jen. Yeah, let me, this might be just a tad light, so let's try A3. Okay. Alright, that's a little better. A little more translucent. I have a Charisma A3, please. Alright, I've got to go and grab something real quick. We'll see you at the next segment. Dr. Jerry Cuomo, I'll be